Have you heard about a bubble study? This is one test which will tell you if the patient has a heart problem or a lung problem. Okay, bubble study is nothing but it is just a contrast enhanced echocardiography. We use agitated cell line. Okay, here the procedure is first the patient will lie down supine and an IV access is secured and the saline is properly shaken. Okay, see, normal saline is taken in the syringe, it is agitated, meaning it is shaken with air, and that will form micro bubbles, and the bubbles are usually more than 10 micrometer in size, and this is rapidly injected into the vein. Okay, IV it is given. Now, simultaneously, when you give the injection, along with that, remember you have to perform transthoracic echocardiography. And here, while doing echocardiography, you need to focus on the right atrium, right ventricle, and the left atrium. So, in a sequence, you'll focus on these three things: right atrium, right ventricle, and left atrium. So, normally, what happens is the microbubbles initially will appear in the right side of the heart, okay, that is right atrium and right ventricle. And when from the right ventricle, when the bubbles are sent to the pulmonary circulation, remember these bubbles are trapped in the lung. So in a normal heart, sorry, in a normal person, these bubbles are trapped in the lungs. So lung is like a filter, okay, so all these bubbles which are more than 10 micrometer in size are filtered out. This is a normal response. But what is an abnormal finding? Now imagine there is a opening in the interatrial septum. Okay, it can be because of atrial septal defect or patent foramen ovale. The bubbles will easily move to the left atrium, and this happens within 3 cardiac cycles, meaning within 3 heartbeats this bubbles will enter into left atrium. But in case of pulmonary dilatation, what happens is the bubbles will move from right atrium to right ventricle, then goes to pulmonary circulation, then comes back to left atrium. Here what has happened, the pulmonary blood vessels are big enough to allow the passage of more than 10 micrometer bubbles. But in a normal person, what has happened? The blood vessels are narrow. This will not allow the bubbles to pass through the pulmonary blood vessels. So bubbles will not normally be seen in left atrium. Okay, so this is one of the gold standard tests done in hepatopulmonary syndrome.